This is a very quick video. It's section 3, and it's talking about preventing and delaying type 2 diabetes. I know I've emphasized this in my other videos, so this is going to be very quick, but I know I have the slide set and I didn't want to miss anything that is important. So we talked about, remember the last videos where if they're age 45 years and older, we start screening, as well as 3 years after that, every 3 years, if they do not have diabetes. But if you're pre-diabetic, you really should have annual monitoring of, and what do we mean by annual monitoring? That would be meaning a fasting blood glucose level and perhaps an A1C. I always check A1Cs with the basic metabolic panel to make sure what their average is and just see what their fasting is. So lifestyle interventions are very, very, very important. And that, again, is one of my most emphasized things out of this entire slide set is its lifestyle change and interventions. So weight loss, physical activity, and as you can see here, these are different studies. So this is an A recommendation to refer all patients with prediabetes. And so I treat my pre-diabetics as diabetics, and I tell them that because they take it more seriously. I have found through the years of treating patients with diabetes, I've tried the nice approach, and I'm definitely not mean with my patients, but I'm very real with them, and I tell them, hey, this is what's going to happen if you don't do this. And for me, it's been most successful because, again, I help them with behavior change, but I am real with them and say, this is what's going to happen. These are the complications if you don't get your blood sugar under control. And I go through what insulin resistance is for them. Pharmacologic intervention. So we should consider it in pre-diabetics, especially for those who are more obese or in the obese range, not just the overweight range. So BMI of 35 or greater, those are who are less than 60 years old, and women with prior gestational diabetes. So now going back to my own case study, I should have been on metformin because I had borderline blood sugars and gestational diabetes. So number one, I'm a healthcare provider, and you know we're the worst patients, right? So yes, I knew that I probably should have been on it and I didn't, and now I see what happened. Not saying that if I wasn't on it before, I wouldn't have diabetes now, but I think this is a very good recommendation. And number two, if I was just a person that did not know this knowledge, we're really doing a disservice to the population if we're not at least informing them of their options. And this talks about metformin may be associated with B12 deficiency, and so just check B12 levels. And symptomatic patients, you want to make sure that you're checking those, because remember what B12 deficiency symptoms are: numbness, tingling, that stocking glove neuropathy, and so that can mimic peripheral neuropathy. And prevention of cardiovascular disease. So you're 4 times more likely to have an MI if you have diabetes. So we have to screen for. And talking about risk factors, there's non-modifiable and modifiable. Non-modifiable, you can't change whether what your sex is, you can't change your age, and you can't change your genetics. You have those that they're working against you perhaps if you have a history. But there's modifiable factors such as lifestyle, such as diet and activity, the types of food you're putting in your mouth, that you can modify. Unfortunately, if you have what I call metabolic issues or carbohydrate intolerance, hence diabetes, I'm talking about type 2, not type 1, that's different, then you have to just work harder than the other part of the population that doesn't have metabolic predisposition. And it's no different than having anxiety or depression. If your whole family has anxiety, you have anxiety, and you just have to manage things a little bit different than the person next to you that doesn't have anxiety and can go speak in front of people without any problems. And that's it.